The lymphatic system is a major part of your body's immune system. It includes your lymph nodes, bone marrow, spleen, and thymus. Lymphoma occurs if cancer forms in the lymphatic system. The two main types include Hodgkin's lymphoma. People with Hodgkin's lymphoma have large cancer cells called Reed-Sternberg (RS) cells. Non-Hodgkin's lymphoma. In non-Hodgkin's lymphoma, RS cells aren't present. This type is more common. Between these two categories, there are more than 70 subtypes. They range from slow-growing cancers to aggressive, fast-growing forms. Most cases of lymphoma are usually considered treatable. But it's still a serious condition that requires medical attention. Additionally, your overall outlook depends on early diagnosis. The sooner you get checked, the better your outcome will be. If you have lymphoma symptoms, promptly visit a doctor. They can provide a diagnosis using tests like blood panels, biopsies, and more. Diagnosing lymphoma. A doctor will use multiple procedures to diagnose lymphoma. The exact combination of tests will depend on your symptoms and overall health. It may include physical exam. When you first see the doctor, they'll perform a physical exam. This lets them analyze your symptoms, which provides a baseline for your diagnosis. During a physical exam, a doctor will look for swollen lymph nodes in the neck, groin, and underarms. Check for swelling in the spleen and liver. Ask about your medical history. Examine any other physical symptoms. Blood panel. After the physical exam, the doctor will likely order a blood test. This looks for specific markers in your blood that might indicate lymphoma. It also helps your doctor rule out other possible causes of your symptoms. A typical blood panel includes complete blood count, CBC. CBC measures certain parts of your blood, including red blood cells, which transport oxygen throughout the body. If lymphoma disrupts red blood cell production in the bone marrow, you may have a low red blood cell count, or anemia. White blood cells, which fight infection. A low white blood cell count can occur due to lymphoma or other conditions, like an autoimmune disorder. Platelets, which are cells that clot the blood. Lymphoma in the bone marrow may result in a low platelet count. Liver and kidney function. Your doctor may also want to check how well your liver and kidneys are working. A liver function test for albumin might help diagnose advanced lymphoma. The condition can decrease levels of albumin, a protein produced by the liver. Lactic dehydrogenase, LDH. Your blood panel might include LDH, an enzyme that's normally found in most of your tissues. Some forms of lymphoma increase LDH production. However, since high levels can occur due to other diseases, you'll still need other tests to help with the diagnosis. C-reactive protein, CRP. During the inflammatory response, the body produces C-reactive protein. High levels in the blood may be a sign of cancer, including lymphoma, but could also be due to other sources of inflammation. Lymph node biopsy. A lymph node biopsy is the gold standard for diagnosing lymphoma. Often, it's the only test that can provide an official diagnosis. During the procedure, a specialist takes a sample of a lymph node. The sample is examined under a microscope for signs of lymphoma. The sample may also help your doctor determine the type of lymphoma and how fast it's growing. Types of lymph node biopsies include excision biopsy, which removes all of one lymph node; incisional biopsy, which removes part of a lymph node; or needle biopsy, which only removes a small lymph node. Sample laparoscopic biopsy, which uses small instruments to remove a sample deep within your body. The best option depends on your overall health and where the affected lymph nodes are located. Imaging tests. A lymphoma diagnosis often includes imaging tests. These tests allow your doctor to locate enlarged lymph nodes, check if other organs are affected, look for tumors. A doctor might use the following tests. Ultrasound. During an ultrasound, sound waves bounce off tissues and organs to create a picture. Ultrasounds are used to examine swollen areas or find the best location for a biopsy. X-ray. An X-ray uses radiation to take detailed images of the inside of your body. Computed tomography, CT, scan. In a CT scan, narrow X-rays are used to take detailed 3D pictures. Compared to X-rays, CT scans take clearer images of swollen lymph nodes. Positron emission tomography, PET. Before a PET scan, you're injected with a radioactive form of sugar, which is taken up by cancer cells. These cells clearly appear on the scan. Magnetic resonance imaging, MRI. If your doctor thinks you have lymphoma of the central nervous system, you'll get an MRI. Bone marrow biopsy. Bone marrow is the soft, spongy tissue inside most of our bones. It makes important blood cells, including red blood cells and platelets. If your doctor thinks lymphoma started in your bone marrow, you might need a bone marrow biopsy. In this test, a small sample of bone marrow is removed and checked for lymphoma cells. A bone marrow biopsy isn't required for all lymphoma diagnoses. Your doctor will decide if you need one. Immunophenotyping. Immunophenotyping is a laboratory test that checks the affected cells for specific markers, called clusters of differentiation, CD. Methods of immunophenotyping include immunohistochemistry. In this test, antibodies are used to check a tissue sample for specific proteins. The antibodies stick to the proteins, which activates an enzyme or fluorescent dye. This shows up under a microscope, which allows a specialist to determine the type of lymphoma cells. Flow cytometry. Flow cytometry uses fluorescent antibodies to stain blood cells. The blood is placed in a flow cytometer, which evaluates number and percentage of cells, cell size, and shape. Specific markers on the cell surface. Your doctor can use the results to diagnose lymphoma. Chromosome tests. Chromosomes are made of DNA strands. In some cases, lymphoma can alter these chromosomes. To find these abnormalities, a doctor might request chromosome tests, including cytogenetic analysis, which looks for chromosome abnormalities using a microscope. Fluorescence in situ hybridization, FISH, which uses fluorescent dyes to identify chromosome changes not visible under a microscopy. Polymerase chain reaction, PCR, which identifies specific DNA alterations. Does diagnosis differ by type of lymphoma? The process of diagnosing lymphoma is typically different for each person. The exact tests you need depend on the type of lymphoma you're being tested for. In general, the main way to diagnose both non-Hodgkin's lymphoma and Hodgkin's lymphoma involves a lymph node biopsy. This includes diffuse large B-cell lymphoma, the most common form of non-Hodgkin's lymphoma. Some subtypes of lymphoma require specialized tests. Central nervous system lymphoma. Diagnosis usually involves a lumbar puncture or spinal tap. This test checks for lymphoma calls in the cerebrospinal fluid. Primary gastric lymphoma, PGL. To diagnose PGL, an upper endoscopy is used to collect biopsy samples from your upper digestive tract. It's often combined with an endoscopic ultrasound, which takes pictures of organs and lymph nodes deep inside the body. Follicular lymphoma. Typically, FISH is the most accurate test for diagnosing follicular lymphoma. Skin lymphoma. Also called cutaneous lymphoma, skin lymphoma diagnosis requires a skin biopsy. Bone marrow lymphoma. If lymphoma starts or spreads in the bone marrow, you'll need a bone marrow biopsy. You might also need additional tests to determine the stage of your lymphoma. Treating lymphoma after diagnosis, your doctor can create an appropriate treatment plan. This depends on many factors, including type and stage of lymphoma, your symptoms, our overall health. Our preferences options include active monitoring, also known as watch and wait. This approach includes regular checkups without medical treatment. This is used for slow-growing forms of lymphoma. Chemotherapy. Chemotherapy drugs destroy cancer cells. They can be taken orally or injected into a vein. Radiation therapy. In radiation therapy, powerful beams of energy are used to fight cancer cells. Biological drug therapy. This treatment helps your immune system target and kill cancer cells. Bone marrow transplant. If your bone marrow is affected, you might need a bone marrow transplant. This is an infusion of healthy bone marrow stem cells from your body or a donor. Takeaway: generally, a lymphoma diagnosis requires a lymph node biopsy. This test is done by removing a sample of your lymph node and checking it for cancer cells. You may also need blood tests and imaging tests. Though diagnosing lymphoma takes time, it's a very important process. Official diagnosis will allow your doctor to create the best treatment plan for your needs.